Hello, my name is Amber Miller, and today I'm going to be presenting the brain in the first 2 years of life. So here is my general outline. First, I'm going to be going over the brain. So I'll be going an overview of it, its growth throughout your life, the lateralization of it, and its neuroplasticity. Next, I'm going to be going over neurons. So we'll be going over an overview of them, and then its synapses. Finally, we're going to look at neurological diseases and disorders, their cause, the importance of early diagnosis, and their common symptoms. So why is this all important? Well, more than 300 syndromes have been described as DBD, developmental brain disorders, that are associated with changes in brain wiring. So if your brain is going through a bunch of wiring, which happens in the first few years of life, there's a chance that something could go wrong based on environmental problems or like when you are going through your first few years of life or in the womb, something wrong could happen and connections are made bad, and it could lead to a developmental brain disorder. So here we're going to go over an overview of the brain. So the brain is made up of 2 hemispheres and 4 lobes: frontal, parietal, temporal, and occipital. These all have different functions, and then you will also have your auditory cortex, your visual cortex, and your cerebellum. But your main cortex consists of all your lobes, and it is where you'll see the most neural activity. So in your frontal lobe, which is right here at the top of your head, you're going to have your thinking, planning, and memory area, and then you will have your parietal lobe, which is processing information about touch. Next, we're going to look at our occipital lobe, which is your visual information center. Finally, this big one right in the middle is your temporal lobe, and this is where you're going to process hearing and language. Now, the brain grows very fast. The newborn brain is approximately 33% of the adult brain at birth, and in just 90 days is already at 55% growth. Now, the brain regions don't actually grow all at the same rate. Some grow faster than others, and in fact, the cerebellum grows the fastest. And your cerebellum is where you have motor control and movement. So, by 3 months, it will actually more than double in volume. The brain will also go through lateralization. This is where different functions will be localized more than one side. So when you're doing a task, one side of your brain will function more than the other. And then during these different tasks, one hemisphere of your brain can actually become more active. And this has been shown to show asymmetries in the fetal brain. So one side of your brain will actually look different than the other side of your brain, depending on like what task that side of your brain focuses on. Your brain can also go through a process called neuroplasticity. This is the brain's ability to change both physically and chemically to enhance its adaptability to environmental change and compensate for injury. In other words, this means if one area of the brain is damaged, neurons, which I will talk about actually in the next slide, they're able to rearrange themselves and repair. So here is what a neuron is. A neuron consists of the cell body, which have dendrites going off of it, and they are able to receive messages from other cells. So the cell receives a message, and the cell body is also called a soma, and then this message can go through this axon, and when that happens, an action potential is stimulated, and this is an electrical signal that will travel down the axon and help the message get to the terminal junction. The axon can be covered by a myelin sheath, and this can help speed along the electrical signal. So once the message reaches the terminal junction, it can then pass along, and the dendrite can receive this message, and this dendrite is then connected to the next cell. So the neurons overall are just a way to send a message from one cell to the next. So neurons continued. So what else about neurons? Well, they have the synapses, and the synapses is right around here between the terminal junction and the dendrites. So they're where the neural connections are formed. Now, when you are young and just starting off life, you're going to have the synaptic blooming where you're going to have rapid neural growth and you're going to form a bunch of connections and everything. And actually, by the age of 2, a single neuron might have thousands of dendrites. And then you'll also go through a process of synaptic pruning. This is a neural elimination of extra, quote unquote, extra synapses. So you're going to combine different neurons and their synapses to be one and strengthen the bond so it's faster and more efficient. Finally, let's look at neurological diseases and disorders. There are a bunch of different diseases and disorders I could list out, but it goes on for a long time. So these are damages and defects in the brain that can cause different different defects that can be present at birth, and that would be congenital, or they could form during the first few years of life due to different factors. So what is the cause? What are these different factors? They could go through genetic factors, or you could have something like a brain injury that happens, or environmental factors could have a play in it. So it could be due to FAS, fetal alcohol syndrome. So if your mother drank while you were in her womb, you could have an infection during your first few years of life, or maybe your mother has a drug addiction. So what is the importance of early diagnosis? Early diagnosis will help improve understanding of the underlying causes and provide a means to develop accurate genetic testing, counseling, and ultimately effective therapies for DBD, developmental brain disorders. So finally, if you have a kid and you're looking like what are the common symptoms, what do you have to look for if you're kind of worried that this might have happened, you're going to look for, obviously through like an MRI, a corpus callosum malformation, difficulties with language development and reading, epilepsy, which is seizures, visual and or hearing impairment, motor impairment. So if they have abnormal movement or delayed movement milestones, so you're really looking if they have, if they're not reaching their milestones at the right time. And then intellectual delays and learning difficulties. And that is my slideshow on brain growth through the first few years of life. And here are my resources. Thank you for listening.